Today I discussed two of the programs that I oversee at the Vermont Department of Health. The first one is the Climate Change Adaptation Program, and the second one is the Environmental Health Tracking Program. I gave some background on climate science generally and my understanding of how climate affects human health and how public health researchers and epidemiologists are approaching the issue of climate and health, and what the federal government is encouraging states to pursue in terms of adaptation planning to try to make public health infrastructure more resilient and identify actions that state and local departments of health can take in order to protect their populations from climate change health impacts. So public health is a useful discipline, I think, when it comes to addressing the climate change issue. And the reason I say that is because we have some history dealing with intractable, difficult, chronic health problems. And so whether you're talking about smoking or obesity or diabetes, those are all issues where you're asking someone to change their behavior today for benefits that they will reap at some point in the future. So public health has developed this prevention model: primary, secondary, and tertiary prevention. And you can apply that kind of model to responding to the health risks of climate change. And the way that people usually map it is primary prevention is how can you prevent the problem from coming about to begin with. And so for climate change, that's through mitigation and decreasing heat-trapping gases. Secondary prevention is usually, if there's an epidemic, how do you contain it? So applied to climate change, that's for the portion of climate change that's inevitable, how do we adapt to it? And that's really the focus of what the Climate Change Adaptation Program is working on. And then the last part, tertiary prevention. The disease is here and it's already struck. How do you manage the symptoms in order to minimize the impacts to the greatest extent possible? Usually that's thought of as the emergency response function. When extreme weather events happen, when crisis strikes, what's the role of government in order to minimize the severity of the problem, to make sure that a natural disaster doesn't turn into a man-made disaster? How do you do emergency management in such a way that you're really making the problem better and not worse? So Vermont is an incredible place to be working on the issue of climate change adaptation right now, and that's because there are so many different groups in state government, in local government, in the NGO sector that are working on these issues across different domains, from transportation to agriculture to energy. So there's really an abundance of co-collaborators out there, and a lot of them are interested in what the impacts of climate change or their particular sector that they're working on, how that's going to impact health. There are really a lot of data sources that are helpful for us to harness, and then hopefully the information that we're generating in terms of projecting what the health impacts are going to be 20, 40, 60 years down the line will be useful to the folks who we're working with in terms of decision making and planning that they're doing. And people are really engaged on the issue. It has a salience and a level of visibility that I think it'd be very rare to find in other places. And so it's very gratifying to work on this topic in Vermont because it feels like you can really accomplish a lot.